Hello, my name is Sansanee Craig. I am a primary care pediatrician at the Children's Hospital of Philadelphia, or CHOP. I help lead CHOP's Global Health Informatics program that aims to leverage health information technology to improve healthcare globally. Today, I will share part of an ongoing collaboration with our Dominican Republic partners to advance e-health readiness in the clinic there. As I discuss this collaboration, I will be walking through the stages of a health informatics system project lifecycle and use a case example from the Dominican Republic to demonstrate these different stages. The example I'm using is a collaborative between CHOP and a pediatric clinic in a rural area in the Dominican Republic to move from paper to digital data during remote deworming campaigns. For some background context, the nurses and community health workers in this clinic go out to the neighboring areas twice a year to distribute deworming medications to children ages 2 to 5. Afterwards, the nurse will go back to the clinic and document the deworming medication into the patient's paper charts. When we started this project, periodically the nurse would go through the paper charts and create handwritten, de-identified summaries of the number of deworming administrations in each neighborhood, as you see on the left. The clinicians and the nurses in this clinic want to transition from paper to electronic data capture, starting with these deworming campaigns. Health informatics projects take a general approach with the following phases: engaging the stakeholders within a clinic site who are going to be actively involved and who understand the details of the clinical workflow and data needs. Assessing the current landscape to better understand the needs that the health information technology is being used to address. In the next few slides, I'll discuss 3 steps of conducting this landscape assessment. Once the needs are identified, then selecting the technology that best fits the need. Implementing the technology, which includes evaluation steps, then maintaining, optimizing, or retiring the technology. And I want to call out that specifically for global health settings, it is critical that the stakeholders are not only engaged, but actually initiate the project. Unless there is a champion within the team who is willing and able to lead the implementation forward, this project is likely not going to be successful. I'll go through these project phases step by step using the deworming project as a use case. So going back to the first step, engaging the stakeholders who are going to be actively involved. As I mentioned, in global health informatics, a stakeholder in the clinic site who is able to and willing to lead, who is able and willing to take on a leadership role within the project is critical. This needs to be done from the beginning, but also continually as the project progresses and additional stakeholders are identified. In our case example, Dominican Republic clinic leaders collaborated with leaders from the informatics and global health centers at the Children's Hospital of Philadelphia. I'd like to pause here and say at this stage, it is critically important to identify which of the clinical key stakeholders or group of stakeholders will help to build, maintain, optimize, and fix the technology going forward. This long-term plan is crucial to avoid an unfortunately common phenomenon known as pilotitis, where a pilot fails to scale up after the initial funding, like a grant, ends. So next, the landscape assessment, which I've broken down into 3 steps. The first step is understanding how health information and health data is currently being collected and used. This involves a comprehensive understanding of the following: the environment, the people, the tasks that people do, the processes that occur, the data type that are collected, the roles of the people who generate this data, and where in the clinic workflow data are generated and used. In our case, some key points from the landscape assessment we conducted are the following: that there is limited internet, electricity, and national e-health infrastructure. Physicians, nurses, and community health workers will be using the technology in a rural clinic setting initially for deworming campaigns conducted off-site remotely in the neighboring areas. The processes and tasks within scope for this project is the deworming campaigns that I described earlier that occur twice a year outside the clinic setting, and the current state of data flow is the documentation of care I described earlier. So after the current state is understood, the next phase of a landscape assessment, it asks, what is the problem with the current state? For whom is it a problem, and do the stakeholders all agree on the problem? In our use case, the problem with the current state is that data are locked away in paper charts, which creates challenges to quickly and easily analyze the data and generate reports. An additional problem is the lack of granularity on whether all eligible patients receive deworming medications, apart from the general sense that everyone is dewormed. So there is little data to support that all eligible patients have been reached. When these problems were discussed with the clinic leaders, they agreed that these were the problems. They added an additional problem that we were not aware of, the need to expand the head nurse's responsibilities beyond managing the deworming campaigns. With the introduction of a standardized electronic data platform, community health workers could do the same job as the health nurse, freeing her to do other tasks to better support the clinic. And these are outlined in these steps here. The final part of conducting a needs assessment or landscape assessment asks, how will the data be used? Health data can be used in research to answer questions like, is this hypothesis credible? To help augment patient care and address questions like, is this patient due for immunizations today? To support clinic quality improvement efforts, and that answers questions like, are our interventions improving health outcomes? Support a larger health system, mostly around financial questions, or share across institutions beyond the healthcare settings. In our situation in the Dominican Republic, data are needed to improve deworming campaign reach, build data quality culture, and introduce digital health technology. After all the prior steps have been completed, and only after they've been completed, can the technology selection phase begin. This is usually the part that most is interesting to donors or funders, but it would be a costly mistake to start here before first doing the initial steps of stakeholder engagement and needs assessment. The technology selected must meet the identified needs as well as the intended use of the health data. For example, in research and quality improvement alone, a REDCap or research database or Excel spreadsheet may be sufficient, but at the level of multi-system sharing, more robust tools are needed, such as health information exchanges and registries. This is the basis of the eHealth readiness or digital maturity model concept. In our use case, we selected a cloud-based software that could capture digital health on tablets in remote areas without internet to meet these needs. Very importantly, before you launch any technology, it is critical to plan for an owner to maintain, optimize, and fix the technology going forward. And if the technology becomes obsolete or inadequate, then to retire the tool. So this owner, as I said, should be embedded within the clinic team in the country and have the skills and relationships with the staff to help these aspects of technology implementation. In our use case, the clinic hired a full-time IT staff member to help guide the implementation and maintenance of electronic software. We piloted the software with mixed success, mainly finding challenges with data extraction, scalability, and sharing capabilities, so we're currently in the process of retiring the software and implementing an alternative research database substitution called REDCap. And although I outlined this journey as a linear journey, it is important to note that developing health information systems technology is iterative, and multiple episodes or multiple cycles of improvements can be done within one technological implementation project. So this is a very simplified view of the phases we use to implement the electronic data capture tool. A key point here is that the clinic staff who will be using the tool must be involved in the design of the tool from the beginning so that the tool will work within the clinic workflows, will actually be used, and result in high quality data. If this is not done, there's a risk that a wonderful new tool will be built but not used by the staff. The other steps include iteratively designing, testing, training, launching, and evaluating the success of the tool. Maintenance and optimization steps are listed here as last, but as I mentioned, should be considered from the very beginning. So in summary, health informatics projects take a general approach with the following phases. In our Dominican Republic project, we followed these phases as outlined before. And some takeaway points is that health information technology must be sustainable, interoperable, and usable in clinic workflows. Conducting a health assessment, needs assessment must be conducted to fully outline the current data flow, peoples, and tasks. Key stakeholders must fully understand current state and agree on the intended use for health information technology and health data. The selection and implementation must meet local needs and in the environment, and that maintenance and optimization needs must be factored into the cost of the implementation from the beginning. The clinic team involvement is critical from the initial stages to the very end in order to ensure successful change management and implementation. Thank you so much for your time, and here's my information if you'd like to reach out to me with more questions.